Mm.
Deanne should be joining now.
Okay, great.
Good morning.
Good morning, Deanne. Welcome.
Thank you.
So we're waiting for one more member
We
to
are.
join us.
Yeah, and we still have
Quorum.
2 more minutes before 9 a.m. anyway, so
Okay.
Lindsay, I'm going to join from my computer here in just a minute, so if you'll just be on the lookout for my other device.
Thanks, Deanne.
Thank you.
I am seeing a phone joining, which
I bet
might
that's
be
Deanne.
Senator
Or is that
Erickson.
Senator Erickson?
I'm not sure.
Is that you, Senator Erickson, on the iPhone?
Yes.
Great. Welcome.
Okay.
And thank you. All right, Don, we are at quorum. We've got 1 more minute till 9 a.m. So when you see that clock turn, we're good to go.
Okay, sounds good.
And for an extra audible cue, I'll hit record and it'll announce it to everyone.
All right. All right. Well, good morning, everyone, and welcome to the February meeting of the Kansas Children's Cabinet. We appreciate all of you being tuned in to join us in this meeting. We do have a quorum. We are somewhat shorthanded, so we may have some more board members join us as we proceed with the agenda. But we do have a full agenda, so we will go ahead and get started now. First item on the agenda is approval of the December minutes of the December meeting. Those were emailed out to all board members. You've had a chance to look them over. I would entertain a motion to approve the minutes.
This is John Wilson. I move that we approve the December minutes.
This is Leetta. I'll second.
All right, thank you both. Motion has been made and seconded to approve the minutes of the December meeting. All those in favor say aye.
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 Those opposed, no. The motion carried. Next item on the agenda is the Capital Projects Fund Accelerator grant proposals for round 2. You may remember some proposals were awarded back in October, but the majority of the funding was held back for a round 2, and that is now before us for our consideration. So, Melissa?
Thank you, Don, and appreciate everybody's attention on all of the prep materials that went into this meeting. I know there was a lot sent to you. We are really excited to have our second round of the Capital Projects Fund Accelerator grants to share with you today for discussion and consideration of approval. So if we could move on. Okay. Just to remind, the purpose of these funds is very specific. This is federal funding provided through the American Rescue Plan that went to U.S. Treasury as an infrastructure improvement pool of funding, originally intended for broadband expansion. Subsequent to the passage of the American Rescue Plan, there was a significant package of legislation passed by Congress to address both broadband and infrastructure projects writ large. So the rules governing the use of this fund were updated by Congress. They gave direction to US Treasury to expand the allowable use of the capital projects fund for additional construction projects. Those projects very specifically have to be multi-purpose community facilities that support activities that help people work, expand educational opportunities, and offer healthcare monitoring and services. We spent about 18 months, we being the cabinet, the Office of Recovery on behalf of the state, negotiated with US Treasury for about 18 months to be able to add childcare as a mandatory function of these multi-purpose community facilities. Our first proposal, the writing of our proposal framed childcare programs as the program that would support work, education, and healthcare monitoring and service provision. The case we made was that the workforce needs, the parents in the workforce need high quality early childhood programs for their children to safely be cared for while they report to work. Children get educated in the preschool and the early education offerings, and we do all kinds of healthcare already through childcare programs. So, meeting that would be a simple add-on of space for providers to conduct screenings and do telehealth visits and all sorts of things. They said no. They said you must have multi-purpose community facilities that do all of these things in a broader sense for the community. So the workforce training just to train up childcare workforce was not enough. You needed to have partners in the community, and you need to really deliver an array of services that meet the community needs. The applications also have to indicate how this is being responsive to the COVID-19 pandemic and addressing needs exposed by that 3 years of crisis recovery and response, and lessons learned in the community, how the facility will meet a need so that in the future it's easier to cope should something so dire occur again. And the buildings have to be equipped with updated broadband capabilities. We are also expecting certain outcomes, which in the interest of time, they've been on screen for a few minutes. I'm not going to walk you through each item, but just know our usual cabinet approach to impact reporting, to assessing whether we are not just checking boxes to meet criteria, but having a positive impact on communities, whether or not these projects are meeting the kinds of things you see on screen. So that's the purpose. As a reminder, we originally had $38 million in total funding. I've already gone over the funding source. We are dealing directly with US Treasury on these funds. It is funding that can only fund construction. So if you recall earlier, in 2023, we had 2 rounds of funding in a different grant program called the Child Care Capacity Accelerator. And we had funds that we received from the state fiscal recovery funds. We had 20 million for that we were allowed to use for construction. Our partners at DCF provided $20 million in matching funds for major startup operations to match in. And then we put together, we had the gift from the Patterson Family Foundation, and that they were willing to let be used for construction or operations. And then our preschool development grant, we had $1 million that helped with the innovation communities to pilot some strategies. So this is very different in that we don't have all the other funding sources, strictly the Capital Projects Fund, which is construction only. We are repeating that the explicit design considerations have to enable work, education, healthcare monitoring, and include licensed childcare, new licensed childcare slots. Additionally, federal criteria required applicants to submit a 5-year sustainability plan to show us how they intend to keep the doors open of these facilities to conduct the activities they're proposing, and have 15% community match. So whether it was land, an existing building that were donated to the cause or purchased through other means, or whether it's community cash match or whatever, that they're 15% of the total cost of the project had to come from at the community level. A reminder that we opened both round 1 and round 2 applications on September 5th, 2023. All of the materials have been available on our website since that time, the RFP, the guidelines, technical assistance, our webinars, all of the things. And we have provided many hours of support to potential applicants through our partners at KU Center for Public Partnerships and Research, so that people had answers to their questions. Round 1 applications closed October 2nd. We held our special meeting on October 19th to approve the first slate. There were 3 projects that succeeded in meeting all the criteria, and we were delighted to be able to fund. Round 2, the application closed on December 18th. So for round 2, you had that run from September 5th to December 18th to really dig in and work as a community to meet the conditions the funding requires. So we're here today to entertain the slate and give approval to the round 2 grant awards. The funds have a timeline. They can be spent through the end of September in 2025. So there is still adequate lead time to engage in the construction of the new building facilities. The review process is very similar to the way we always approach our grant making. We had first just an initial screening for basic eligibility and completeness of the application. Were all of the pieces that were required submitted? Do we see on a quick scan that they are in fact proposing a project that meets the basic eligibility? And then we had an external review team. We seek always to have reviewers with diverse expertise. We put 2 reviewers on every submission. We have a whole enough reviewers on that outside team that no one person is looking at every one of the applications, and there's diverse eyes and expertise brought to bear. The rubric that the review team uses for scoring is outlined in the RFP. So the criteria and the point system was known to applicants at the start, so they could take that into consideration as they worked to draft their applications. Once that initial external and the external review are done and we get the scored applications back, we have to do a review in-house, take in the notes and the scores from the review team, map it out, because we are always seeking geographic diversity to make sure that our families all across the state are seeing needs met with new projects to the greatest extent possible. Make sure that the compliance issues for, especially in this particular set of projects, are they fully complying with the federal rules? Where we see differences in a very competitive environment, where are the strongest applications and the strongest project plans? And then, as I mentioned, the support was provided by the CPPR team. So they were not part of the review team itself. They weren't involved with scoring, so it allows them to give technical assistance to applicants that requested and make sure people understand what is expected. So that's our process. It's pretty rigorous. Between December and today, we all we know we had holidays and time off and lots of rotating schedules. So it's been a sprint to get it done, but we are really excited to share the slate with you today. As a reminder, round one, we received 12 total submissions, totaling $63.1 million requested. We found 3 of those 12 to fully comply with the criteria and give us really exciting proposals to fund. The total amount awarded was $10.2 million. And the total number of new childcare slots adds up to 313. And you can see the reminder of the location of those programs. The Community Children's Center is in the city of Lawrence. The Grove Community Center is in the city of Hayes, and Little Lions of Emporia obviously is in Emporia. Round 2 was far more competitive given the extra time people had and the lessons learned from round 1. We ended up with 46 project submissions totaling $150.4 million requested. We have allocated every dollar we had to allocate. So we had $27,745.991 available for granting. And so we've made sure to spread that to as many submissions as possible to ensure viability of their project plan. It totals 458 new childcare slots added. So this is on top of the 313 from round 1. And in addition to all of the slots created by the childcare capacity accelerators. So we are continuing our work to add new childcare capacity to communities all across the state. This is the slate, and we know we're going to have, as excited as the folks who see themselves on this slate are, we know there are 39 other applicants who are going to be deeply disappointed in us, and this is always the hard part. But these were outstanding examples of projects designed to meet the full range of federal criteria. The program in Great Bend is in the same neighborhood as the childcare capacity accelerator project, but it is a different site. This is truly a community center. They are proposing they will be providing partnerships with the University of Kansas Health System to deliver healthcare services on site, preventive care and healthcare screenings. Barton County Community College is at the table to help with their education. They've got a curated schedule of classes and different facilities to help with some of the career programs. So they're proposing a culinary center and a broadcast center and just some really exciting features that will expand the offerings of Barton County Community College. They're partnered as well with USD 428. So again, more of the CTE type facilities for the high school students. Kansas Works is a partner at the table. There will be a range of workforce development programs offered in this space, a workforce service hub, a maker space, lots of exciting features. And then they're working as well. They have Sunrise staffing at the table, so job fairs and job training, that kind of thing. Their project also was exciting to us because the childcare component will provide slots for childcare overnight, which is a really, really important form of childcare for parents who work non-traditional hours. So their slots will be overnight slots, and then by day, the classrooms used for that childcare purpose will provide mental health services to the community members. So we thought this was an outstanding example of how to meet that menu of federal requirements. The project in Clay County, they have this Clay County Growth Alliance, but the city of Clay County is our partner. They too have a robust group of partners at the table. They will be partnered with Pawnee Mental Health and the Clay County Health Department, so that the healthcare monitoring and services will emphasize mental well-being through that partnership, and they'll have a wealth of other healthcare services provided. USD 379 is a partner at the table. They will provide, you can see from the package, they'll have the workforce and educational training programs that are necessary. The Clay Counts Coalition, Parks and Rec, and Cloud County Community College are partnered in this project. They will have a senior space. They will have a commercial kitchen. The community can come in and utilize a youth lounge, training rooms, and co-working spaces for workforce training and educational programming. So another really cool partner in a community that to date we had not been able to put any funding in place. So it's growth into a new location. The Greater Manhattan Community Foundation brought us a request related to their Child Care Capacity Accelerator request. This is the one program that is building on that first grant that they received through the Capacity Accelerator. Their original idea was an incubator site for childcare. So they envisioned 10 pods where they could mentor and train childcare providers, and in each pod there would be a group of children that provider will then graduate out into a community space, either in home or some other space in the community, and they will continue annually to incubate new childcare businesses. They saw the grant criteria, took it to heart, and they brought in an application where they are partnered with the Manhattan Area Technical College, Heartland Works, and the Manhattan Free Clinic. So they will serve as a larger type of incubation space. Manhattan Technical College will provide programs on site, and they'll work with Heartland Works and together help job seekers and adult learners in the community. And the primary care services will be provided by the Manhattan Free Health Clinic. It is a really comprehensive approach, and we were pleased to add funding to this project. You will see as they have the most significant reduction from the amount requested to the amount awarded, and it's because we did take into consideration that this is construction funding, and they had received a construction grant in the accelerator, and so the combined construction funding from us is around the target range of 5 million. I think it's a little over 5 million, 5.5 million total for construction, and then they have some other operations funding from the accelerator. So their total package should help them get their project going. Kids Zone is a project in Johnson County in Overland Park. The partners on this with the Kids Zone folks include the Toolbox Small Business Resource Center, Hope United Church, Community Development Association, the Wesleyan University, and Hope Bound. And again, theirs is just a really nice package of services targeted to provide childcare for lower income families, help adults earn online degrees, and carry out the workforce and job training projects, and they will be providing mental health services for the underinsured, and those who receive Medicaid services. So really beneficial programs for the community. We are pleased that we are able to award to St. Benedict's Abbey in Atchison. Atchison is a area that we have long identified as underserved when it comes to childcare. This project is part of a transformation of the former Kansas Juvenile Corrections Facility into a whole new campus that includes First Steps with Abbey Children and it's called the First Steps with Abbey Children and Family Complex. Childcare services will be added by June of 2025 through this renovation and construction. The community partners will use the space, and I should mention it's Northeast Kansas, CAP Inc., with Head Start, basically, the Atchison Community Health Clinic, First Steps Childhood Learning Center, and the Highland Community College. So they will have job training programs, they will have higher education opportunities, provide tutoring programs, the ability for practicum experience, and then the Atchison Community Health Clinic will expand medical, dental, and mental health services on site. Equally excited to welcome Storytime Village to the slate. They will partner with the Workforce Alliance, the Wichita Public Library, and the Health Corps Clinic to create a community center in a neighborhood in Northeast Wichita. It's in the neighborhood of Wichita State University. They will have daily activities related to education and literacy. They'll have workshops that are open to members of the community to improve literacy for all ages. They have new childcare space planned for the project, planning to enroll 50 children by March of 2025. The Workforce Alliance will provide on-site job fairs, workforce training programs, and registered apprenticeship opportunities. And the Health Corps Clinic will provide coordinated care on-site healthcare screenings. They'll bring their mobile on-site clinic. They've got community space, just a community center space. They've just got a really unique development planned for a 1 block square area in the heart of the community where this project will reside. And then finally, we are pleased to be able to offer USD 258, which it's Allen County. They will have Allen County Community College, the Southeast Kansas Mental Health Center, and the Ashley Clinic, all located in Humboldt's area. The community center will include, it'll be on the same site as their current athletic and community complex. They'll add 24 childcare slots focused on infant and toddler care, which is another tough to come by age range to find care. They will have an apprenticeship specific to early childhood as part of that childcare program, but they will expand to have on-site career counselors to help job seekers with job readiness, application support, and interview preparation. The facility will also house an integrated system of care for people from birth through adulthood, which includes primary care, mental health services, and a pharmacy. The expansion of the USD 258 Virtual Education Center will provide adult diploma opportunities and satellite college courses. So this is a really high quality group of applicants, very strong proposals that made us really pleased to put this slate together. It doesn't mean we didn't also have other applicants who had exciting project proposals, but in an environment as competitive as this one, where we had just shy of 28 million to give and $150 million requested, the choices that had to be made were really tough. So demonstrating the strength of the partnerships, demonstrating that you were doing more than just saying, well, we're gonna add a room with computers people would be welcome to come and use, or really just not being able to demonstrate the vitality of the partnerships. That drove the decision making here. We, across the accelerator and the capital projects funds, we have identified projects we wish we had enough funding to have included. And I'll talk a little more about this later in my director's update, but there is funding in the governor's budget proposal that would direct $30 million to the Children's Cabinet that would allow us to basically reopen the Child Care Capacity Accelerator RFP, have $30 million to grants. And a lot of the projects in this CPF round 2 were really incredible childcare proposals that just didn't quite get the community multipurpose segment nailed the way they needed to. So we would envision a public RFP if we were to have additional funding, opening a public RFP, but making sure that all unsuccessful applicants from both the Child Care Capacity Accelerator and the Capital Projects Fund would receive notification so that they would understand there was a new opportunity to apply. So that's my pitch for how, a little piece of hope for those that are not seeing themselves in this slate. We also wanted to show you the slate as a map. So this is where the 7 new sites map out in the state. And I would mention the only community farther west than the Great Bend site. We did have a Dodge City application that falls in that group that we really wish we had the funding to have funded, and we would love the chance to see them able to bring their application to a new RFP if we should get the additional funding capacity. We also wanted you to see the original 3 capacity grants that for CPF. So these are all scattered in distinctly different areas. And then finally, I think we've added in the Child Care Capacity Accelerator so that you can see the range that we have tried to reach. Obviously, population centers have more grants recipients, but we have really taken great pains to try and spread the funding across the state. So if we could go, that is the end of the remarks I had prepared. We do want to give this cabinet board time for questions, Dawn. So I'm ready to stand for questions.
All right, thank you, Melissa. And I just want to repeat my remarks from December. How impressed I am that Melissa and her team put together this proposal and secured the funding for the CPF projects, but also equally impressed with the communities and the leaders in those communities for putting together applications that met all the requirements and have real potential to make a difference in their community. So that's very impressive, and congratulations to all on both sides. Board members, questions, comments? Yes, Leah.
Thank you. So this is so impressive. And look at the champions for Kansas kids right there, right?
Yep.
I actually get choked up looking at this, and excuse me, I've got my rescue dog, which is high maintenance right here, right now.
Puppies welcome. Leah, thank you for that. Every one of these across both grant award programs reflect community engagement. We require that as part of the process. These have to be community partnerships. So you're spot on. The champions we have in Kansas stepped up.
Melissa, you are chief among them because you went to bat with this innovative, creative idea.
Thank you.
Right? For reframing kind of the way the federal funds were used. So I want to thank you for that. You mentioned additional funding capacity potential and the possibility of applying for with a different RFP. And I wondered about that. I know this is a separate discussion, but for those that may be disappointed in not seeing their names on here, their RFP, would you envision that having to require much reworking on their part, or could it just be resubmitted? Do you know at this point?
My hope would be that they, the funding source would be different. If we see this happen, it will be because the legislature adopts the funding recommendation in the governor's budget plan. The source of the funding would be state general fund sourced. So, we would have to wait and see if there's specific criteria added by the state legislature through the budget process. But overall, the intention of that appropriation in the governor's proposal is to put it back into the Children's Cabinet hands to reopen the RFP for the Child Care Capacity Accelerator. So projects that were unsuccessful on this slate would be, that if any, they could, but in both cases, I think the projects exist in a way that would qualify them for that grant funding, barring anything highly unusual. And no, I mean, the core of it is your community partnership, your budget, your scope of work. They're the things that we require. We are working to make grant writing and application like minimizing the heavy lift of that, because we know it can be a burden.
Oh, thank you. I know your team is so exceptional with that. So I want to speak to those that don't see their name on this list. Specifically, keep swinging. You're doing it for the most noble, worthy cause. And we're in the trenches with you. And then for those that wrote the projects that got approved, thank you. It's congratulations. I'm very excited to see this amazing shift in a big change that we're going to see over the coming years for Kansas kids. Thank you guys so much.
Yeah, thank you.
Thank you, Leetta. Further input from board members?
Yep, this is John Wilson. I would just want to second what Leetta said and express my gratitude for those that submitted applications and took the time and energy to do that. And also congratulations to those who kind of proceeded through the rounds. Melissa, my question is a fairly technical question. I see that there was a total funding request of 150.4 million. Yes. Was that were those applicants that met all of the criteria and that totaled 150.4, or were those just the initial application?
That's the initial total ask, and there were some who fell short for this. They, not to say they weren't great childcare proposals, but fell short that, we screened out pretty early on as just not measuring up to the capital projects fund criteria. But we did have if you consider this slate, the seven round one of this group, round two is deeply competitive, just not quite where we had. You kind of have the luxury of choosing the very top tier, and where there were we didn't see quite as much demonstrated strength in the partnerships, or it was duplicative, or in some way there were reasons. So there's another group, and I don't have the dollar amount total of that group offhand, I'm sorry, but there is another group that 30 million won't be enough to fund the demand that's been demonstrated, but it sure would be nice to have additional resources to be able to continue this effort to grow childcare capacity in the state.
Yeah, I agree. And given the requirements from the federal government. I mean, it's like I think of it as like a highly specialized Starbucks order. It's like a venti 3-shot 2-pump. What, like, only so many people are going to be able to get that drink, right?
You're
And meet those
so
requirements
right.
on a short timeline. So I think when we use the term qualified applicants, it's qualified in lots of ways, but particularly you can contort yourself into these federal requirements as qualified. And I would just say, maybe it comes up later, but as we think about the governor's budget proposal of the $30 million for an additional round of capacity accelerator grants, if people are interested in supporting that request, I would be happy to talk with them about how to do that and kind of when to show up in the legislative process.
All right, thank you, John. Further discussion.
Hi, good morning. This is Dr. Tyler Smith. Thank you so much to everyone who submitted their grants, as well as to all of our awardees. Looking at the proposals, I am very certain that it was a very competitive process because of just looking at the information and the services that will be provided to not only just the children, but I also am glad that it expands to the families, because we know if parents and guardians are not doing well, then the kids can't do well also. So I'm glad that it includes that. And also that there are organizations that will also have the capacity for having 24-hour childcare, because for a lot of parents who don't work 9 to 5, their challenge is, how do I get childcare if I work the 7P to 7A shift, as an example? So I'm really glad to see that there's a lot of diversity within the proposals and the services that will be offered to families. One question that I do have is, as we look at proposals moving forward, did we have information, or within the proposals, were people providing kind of a demographic snapshot of their community in terms of the resources that are available versus the resources that are not, so that it also shows what are the gaps that are being filled by the awardees for the grants? And then also looking at, and how does it look in terms of expanding those services and resources?
I am going to invite Amy to weigh in on the content of the specific application. I know through our evaluation process, we absolutely gather that kind of criteria. Amy, can you speak to some of the questions in the grant application?
Sure, Amy Meek with the Children's Cabinet. Yes, the application has a section where they have to address the community needs. And it was actually broken down, I believe, by the different components that we were asking them, or the requirements that they had to provide regarding the health and education and work. So they talked about in their applications what already existed, and then what those needs were in their community, and so forth. So it was a pretty comprehensive application. So did I answer your question?
Yes, it does. Thank you so much. And just one question for my own edification. What's the difference between doing, for example, with St. Benedict's Abbey and Storytime Village, as just looking at funding? What's the difference between 5 million versus 4 million? I just want to make sure I understand what's the dollar difference.
Very, very smart question. The difference the $5 million mark triggers some next level reporting and tracking requirements that we just thought, for a dollar's difference, it might be nice to not put these programs through I mean, there will be annual audits, and there is careful monitoring of the funds as they are spent down, and documentation that has to be provided to back up what they're invoicing for, and all of that monitoring will happen. But $5 million is a next level set of criteria that we just don't think programs like this are equipped to manage on their own. So we wanted to save them from those responsibilities.
Thank you so much for sharing that. I just wanted to make sure that's what I was thinking, but that I also wanted to make sure I understood that, and also that we're thinking about our organizations, because it could have taken a lot to put together their grants, and then also to maintain their grants and the other reports they have to do, that would be another added level and layer that could impact their future of how they keep their grants and the monies. So thank you so much.
Yes, you are right on target with that observation.
This is John. I would just say if that dollar is going to be a struggle for folks, I'm happy to donate to your cause to fill the gap. So one of the few times I could do that.
Would that dollar come with reporting requirements to you?
No.
All right. Further discussion. Seeing none, I would entertain a motion to approve the accelerator grant applications as presented to us today.
This is Leetta. I move to approve the Capital Projects Fund Accelerator Grants as presented today.
And do we have a second?
This is Deanne. I'll second.
All right, thank you, Deanne. This will be a roll call vote. John Wilson,
Yes.
Dr. Tyler Smith,
Yes.
Deanne Owen Graham,
Yes.
Senator Leetta Felter,
Yes.
and Chair Don Heineman, yes. The motion is approved and the grants are approved.
Thank you so much. We are excited. Okay, Don, back to you.
Okay, next up on the agenda is the Kansas Early Learning Standards. And again, let's see, the presenter will be Natalie McLean with Kansas Department of Education. Natalie, welcome.
Thank you. As Don mentioned, I'm Natalie McLean with KSDE. I'm here today because Kansas Executive Order 20-02 designates the Kansas Children's Cabinet and Trust Fund as a state advisory council on early childhood education and care. One of the assigned duties and responsibilities includes make recommendations for improvements in the state early learning standards and undertake efforts to develop high quality, comprehensive early learning standards as appropriate. So I'm going to bring to you today some recommended changes that we've been working on. Next slide, please. So our Kansas Early Learning Standards, which we lovingly refer to as the KELS, is a document that provides information and guidance to early childhood providers and teachers on the developmental continuum of learning for children from birth through kindergarten. The KELS provide information regarding what young children should know and be able to do as a result of engagement with caring, knowledgeable adults, evidence-based curriculum, and developmentally appropriate activities. It's a dynamic resource that providers and teachers can use as they plan activities for, choose and implement curriculum, and engage in conversations with young children and their families around early learning. So they were formed with the following goals in mind. One was to create a continuum that links early development to school readiness and later learning in school life. Second, to provide a clear overview of milestones in a young child's development and how experiencing quality early learning opportunities can facilitate this development. Next, to provide guidance for early learning professionals that enhance and support their abilities to create experiences and environments that promote early learning opportunities and support families. And lastly, to show that during the early years, children acquire skills, knowledge, and abilities in all developmental areas, which are critical for future learning. Next slide, please. So just kind of an overview of what the KELS are and are not. They are designed to recognize the importance of the early years as learning years. However, they should not be used to exclude children from program, school, or activities. So we don't want to say they haven't met these standards yet, so we're not going to let them go to kindergarten quite yet. That's not what they're intended to be for. They are designed to serve as a guide for appropriate curriculum development and the selection, but they're not designed to serve as a curriculum in early childhood programs or other settings on their own. They just kind of guide the selection of what curriculum providers may choose. They are designed to serve as a guide for creating quality learning environments and opportunities, but they should not serve as an assessment for children, families, or programs. So our revisions began in February of 2022. So we've been working on these revisions for about 2 years now. This is the 4th revision of the early learning standards for Kansas. The first document was completed in 2006, a second revision done in 2009, a third revision in 2014. And as with previous revisions, the work was focused on updating the standards based upon new and current knowledge and research. Additionally, specific focus was placed on developmentally appropriate practices, ease of use and accessibility, as well as supporting children from all different backgrounds. This document is another result of the extensive collaboration that's a part of the Kansas early childhood education community. The early childhood community worked collaboratively and intensively to develop a high quality and useful document that will be helpful to all of our early child care and education professionals and be supportive to the work of kindergarten through 3rd grade teaching community. We had guidance from multiple state, local, and national sources during the review process. National, state, and local resources were used to develop a document that's firmly grounded in research, evidence, and developmentally appropriate educational practices. Our partners included early childhood experts from the Department of Children and Families, Kansas Department of Health and Environment, the Kansas Children's Cabinet and Trust Fund, Head Start representative, child care training partners, 2- and 4-year college representatives, child care providers, preschool teachers, and more. Next page, there we go. So here's a quick picture of our team. Again, our revision began with a core team of early childhood education experts, led by myself and Kimberly Kennedy with the Head Start Collaboration Office. And we were supported by KU's Center for Public Partnerships and Research. This team's work began in February of 2022 with a few focus areas in mind before we really began to look into each content area. So these focus areas included looking for missing standards, supporting children from all backgrounds, and then usability of different audiences. So we were kind of looking at how families could use them, how childcare professionals would use them, and how school districts could use them. So work in these areas progressed during bi-monthly meetings through August, when the core team decided that some of the missing standards should be missing. They were not yet developmentally appropriate, but we did find that there had been kindergarten standards developed for some of the missing kindergarten standards that we were able to add. A more intentional statement was added on serving children from all backgrounds. We decided we wanted to develop training and guidance for each of the audiences that were going to be using the standards. And then we also decided that as we worked on this, that the final online document would include examples of what these standards could look like, as well as strategies on how to help children meet standards, to allow the standards themselves to be more user-friendly and help providers with appropriate practices. So as we began to revise the document, we wanted to make sure the standards were not just watered down kindergarten through 12th grade standards, but were actually appropriate for what we would expect children at this age and stage of development. The last revision of the document was very closely aligned to the K through 12 standards, which sometimes led to the standards that were not necessarily developmentally appropriate for our youngest learners. And there's a couple examples here on the screen. So we had a toddler standard that originally said shares with others and takes turns with adult guidance. If you have any 2- or 3-year-olds, you know that that's maybe not age appropriate. we updated that to say begins to share and takes turns with adult guidance. Also, we had physical health and development standard alerts adults to potential harmful situations. This was bumped up to a toddler standard, from a toddler standard to a 3-year-old standard. So the next thing, we also wanted to make sure that standards were easy for all the providers that would be accessing it to understand and to use. Anywhere from our licensed teachers to childcare providers, even for families. So making sure standards were clearly stated was important. Originally, we had some very wordy standards, like this example: create a caring community by considering it a high priority to foster caring attachments between fellow students, staff, and the community. That was simplified to foster caring attachments between fellow children, staff, and the community. So you can see just kind of simplifying language and making things easier to understand. We also wanted to make sure we included all the standards. In several cases, there were kindergarten standards that had either been updated or added. An example of this was in our approaches to learning domain for problem solving. We also added in under physical health and development, both nutrition and safety standards that were not in our last iteration of this document. Part of the nature of early learning is just that crossover between different content areas. There were several instances of standards showing up in multiple content areas or across multiple age groups. The group made an effort to place standards in a single place to simplify the document and to make sure expectations are appropriate for a given age and stage of development. So, for example, demonstrates increasing awareness of others' feelings was removed from toddler standards to prevent a repeated standard from the mobile infants section. Also confirms understanding of a text read aloud or information presented orally through other media by asking and answering reasoning questions was removed from the 4-year-old standards to prevent a repeated kindergarten standard. So once we kind of got the initial overview of the full document, we were ready to dig into our content areas. In August, the core team gathered content area specialists to help with each area. So we pulled in content area specialists from the field on each of the topic areas. Beginning in August, the first meeting of each month centered around a content area and involved a larger group that included the core team along with the content specialists. These meetings were all held virtually. Groups reviewed the current standards and worked to make edits. And then during the second meeting of the month, the core team met to discuss suggestions from the content area specialists and make final decisions on those revisions. In the introduction section of the document, we updated it with current information. So it kind of talks about the full process. So we updated that. We rearranged the order a bit and wordsmith for more plain language. You'll see that's a theme throughout the whole revision process, is making sure that this was easy to understand. We added a statement on the use of media in early childhood on page 16, and based on recommendations, those are based on recommendations from the American Academy of Pediatrics and the Office of Education Technology. We also added a section on supporting children from different backgrounds and with differing abilities. To all the content areas, we updated the introductions and added a key terms section for those who may not know the more technical terms. We also added a statement about supporting children from all backgrounds and abilities on each content area for those who may skip that intro. So I know a lot of practitioners, when they dig in, they'll go to a certain content area and they want to see a standard for a certain age group. So they will skip that intro. So this makes sure that they're seeing that statement no matter where they start in the document. The KSDE graphics team did an excellent job updating visual aspects of the document to make it accessible. It also makes it very easy to use. It's one standard across the age span per page, so it's really user-friendly. We also just updated the numbering to make it consistent throughout. We did a lot of feedback gathering. We had many opportunities for public feedback. It was quite positive, and most of it centered around how much easier it was to understand and appreciation for the plainer language. The revision team took the feedback and considered what changes were necessary and created the final document that we brought to you for your approval. So at this time, I'd like to welcome any questions you may have about our updates.
All right, thank you, Natalie. I appreciate your presentation. And I did leaf through the document, and I was impressed by the simplicity that you were able to achieve in reworking the requirements within the document. So thank you and all of your team for that work. Input from the board.
Hi, this is Monica. Having lived through several versions of this, I appreciate the detail work that was needed to do this. My goodness, lots of detail, lots of opinions. So thanks for doing the work. It is super helpful out in the field as we are having lots of conversations with folks who maybe missed the first couple versions. So it's nice to have an updated format and simple to read. Thanks for all your work on it.
Thank you, Monica.
Hello, good morning, Dr. Tyler Smith. Thank you again for all your hard work on that, as I know that it was a lot to do those revisions on documents, having gone through revisions of even a 10-page paper. So seeing over 100 pages, I know was a daunting task. So thank you to you and your team. And also I want to say thank you very much for separating out some of the metrics that you were measuring, because sometimes when you have metrics that say, for example, expressive and receptive language abilities. Well, when you have that and, if a child can't do one or the other, it basically shows that they failed that metric when really they haven't. It's just that they couldn't do both of them. So I'm glad that you took the time to separate some of those metrics out so that way you could truly assess, okay, well, the child can do one thing, but maybe needs to still work and improve upon another. So thank you so much for separating out those metrics and also making it easy for us to know what some of those revisions were.
All right, thank you, Tyler. Further input? All right, seeing none, I would entertain a motion to approve the updated early learning standards as presented this morning.
Hi, this is John Wilson. I make the motion to approve the Kansas Early Learning Standards.
Monica Murnian, second.
All right, motion has been made and seconded to approve the early learning standards update as presented. Again, this will be a roll call vote. John Wilson.
Yes.
Dr. Tyler Smith.
Yes.
Monica Murnian.
Yes.
Deanne Owen Graham.
Yes.
Leetta Felter.
Yes.
And Chair Don Heineman. Yes. The motion carries and the learning standards update is adopted or approved. Thank you all. Next on the agenda is the Imagination Library of Kansas 501c3. Melissa?
Thank you, Don. And I first want to thank the board for the adoption of the early learning standards and thank Amy for attending all of those meetings as a core team member on behalf of the cabinet. And certainly Natalie, thank you for your efforts leading that work and putting together the right group of stakeholders that has been, I don't know, this is such a low key discussion. I don't know if you know the importance of what we just did, but thank you all. So Imagination Library of Kansas is one of those projects that has just been a joy for the cabinet to take on as one part of our portfolio of work. And as you all know, last year our big the focus effort was to work with our colleagues at the Kansas legislature to get statutory authority for us to create a 501c3 nonprofit organization. So a lot of words on the screen. This is how it was done. It was through a budget proviso, and this is the specific language, which we'll just keep up on screen so you can see it. This gives some specific guidance to how the nonprofit board will be populated. It's telling us the board shall consist of the members of the Children's Cabinet, the executive director of the Children's Cabinet, and other directors designated by the Children's Cabinet. And then, it gives us the authority to receive gifts and donations and fundraise to help benefit the book gifting program. So using this budget authority, we engaged the services of an attorney. I had both some pro bono support from a trusted attorney that I know and actual legal services provided by an attorney who does specialize in the work for nonprofit organizations. So it helped minimize costs. I think so far we have spent about $1,500, and we have the articles of incorporation and drafts of all of the other materials that will subsequently need to be adopted. Today, what I wanted to ask is permission to proceed with the application to the IRS on behalf of this entity, and as your representative, I just would like to take that next step and start the process of forming the nonprofit corporation, as it's known. I sent the articles of incorporation draft. It's it's pretty straightforward. There are required provisions the law prescribes that, plus this added proviso language really set the course. There weren't major decisions that had to be made about the structure of things. This is a very standard approach to forming a nonprofit. So I know you guys have had a ton of information in your inbox to prep for today's meeting, but I wanted you to see that document and open up for some discussion today if you have any questions about this, and then just make sure that this meeting that I have the authority to continue taking the actions necessary to form the C3. So Don, I'll take questions.
Okay, thank you, Melissa. So just for my own clarification, the need for this 501c3 is that once you went statewide with the Imagination Library, there's a need for continuing funding.
Yes.
For that effort to match the 50% match from the Dollywood Foundation. So this is the vehicle that allows you to take in donations and contributions and provide that additional supplemental match that we might need to achieve that goal.
Correct. We're in really good shape with the line item we have currently, but this is to put in place additional capacity to help grow the program. I mean, we are at enrollment. I think we're about halfway to the goal. The goal being set by Dollywood Foundation based on their experience. Their consideration is that full enrollment constitutes 65% of children in the age eligible range in the state are enrolled in the program. And we are at 30 to 35%. So we have grown since the cabinet took over. We've grown by leaps and bounds since July 1, when we were able to really just open up every zip code. But there's a whole lot more growth yet in our future. And there are limits to how much capacity we're going to have with the line item. I don't anticipate, you know, that necessarily growing to keep up with demand in later years. There's also always, I hope this wouldn't happen, but we can't be blind to the idea that there is risk to depending on that line item alone. So the purpose is to have the nonprofit to fundraise and set up a safety net for the program so that we know that it can continue to grow and thrive and exist. We are also encouraged to watch out for distressed local partners and step in. The goal being not to leave any children facing an abrupt end of the program before their graduation date due to lack of funding. So yes, this would give us the capacity to add major fundraising efforts. Currently, the Dollywood Foundation is serving as as the parent entity of the program. We have a service agreement with them, and we can take in donations that they hold for us. It just would be the goal from the beginning has been to reach this point where we have set up the Imagination Library of Kansas 501c3. So this is an exciting step in the right direction and shows the strength of the program and the growth that we've been experiencing. So we're very excited about it.
Okay, thank you, Melissa. Discussion from the board. Was that a thumbs up, Leetta, or a hands up?
It was a thumbs up. I'm excited about it.
Don, we thought this might just be a voice vote. If the cabinet feels otherwise, a roll call is always in order, but just to keep things rolling, I'll let you figure out how you want to handle this. We popped draft language on screen just to facilitate this process.
Yeah, I think a voice vote is appropriate. It's not a finalized proposal, so it's a work in progress, and you're asking for our support to continue working on this project. So this will be a voice vote without roll call vote. So I would entertain a motion.
This is Deanne. I will make the motion. And do you recommend that we just read the draft motion that's displayed here, Melissa?
Yeah, that would be great.
Okay. I move that the Children's Cabinet direct staff to submit an application to the IRS for the formation of a 501c3 nonprofit corporation in support of the Imagination Library of Kansas.
Thank you.
All right, thank you, Deanne. Is there a second?
Second, Dr. Tyler Smith.
All right, we have both a motion and a second. All those in favor say aye.
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 Those opposed say no. The motion has passed, and the initiative is approved. Melissa,
thank you so much.
Melissa / Don, it's John Wilson. Question about this, as I just think about the articles of incorporation, I have no concerns with having just approved it, but just thinking about us as board members are already identified through the Children's Cabinet in public ways. But now when we submit this initial application and with these articles of incorporation, those will kind of have our names tied to them kind of in perpetuity. So just as we think about where our names show up, I think it's just important, or a fun fact.
Yeah, well, I did ask that question of the attorney about naming the names. That is in there as the initial slate of board members. It is under like that. That doesn't mean you're members for life. I mean that can and will change over time. The next step will be that I will work with the attorney. We will go ahead and file. We have the IRS application, and we have to file. It's $20 and a filing with the Secretary of State to go on notice that we are doing this. So we'll proceed with those steps, and then at the appropriate time in the process, the board that's members that are named in the articles will have to meet for the initial organizational meeting, and there I with a lot more lead time and work with you all to walk you through the package of materials that needs to be adopted, that we have drafts of, the policies of the 501c3, the bylaws, all of that stuff. There is a resolution forming the entity that has to be adopted first, and then bylaws, and then these other documents. At that point, the original governing board can begin to work on decisions about adding members from the public sector, changing, choosing officers, how much we meet, when we meet, all of those decisions. And I'm cognizant that our meetings, 6 times a year, we ask for a 3-hour time commitment. That is, it is a commitment from all of you who also have other major busy lives. So we'll need to work together to figure out how we manage the management of this operation, but we'll do that together through that meeting process. So today is really just unlocking the ability to take the next step on your behalf to file the necessary papers. So thank you for approving that.
Next on the agenda is an update on the PDG needs assessment from Melissa and Jessica Sprague-Jones from CPPR.
Thank you, Don. Another major addition to your email inbox this go round. So I thank you for all of the time you've spent reviewing the documents we sent you. This is our new comprehensive statewide needs assessment, which is part of our responsibilities as the state lead for the preschool development grant, Birth to 5 grant funding. So just a quick review. In 2019, the cabinet and the state, the KSDE was the lead at that time, partnered with DCF, KDHE, the cabinet. So our 4 agencies teamed up for a planning grant that we were awarded by, it's the Administration for Children and Families at the federal level. The $4.2 million planning grant, the 2 major deliverable activities were to do a comprehensive statewide needs assessment and draft a 5-year strategic plan. So we accomplished both of those, and thankfully that work was largely completed prior to the onset of the COVID pandemic. So it gave us that really strong foundation from which we then spent the next 3 years coping and responding and dealing with the conditions that the pandemic created. But the needs assessment was the document that we went statewide. We held 52 community listening sessions. We gathered up 45 other reports and sources of information from all across the early childhood care and education system. If you recall, the 2 key, the central messages of that report were that geography shapes the availability and access to early childhood services for children and families in Kansas, and that too many families are struggling to meet their basic needs, which has negative impacts on the development that takes place in early childhood with the developing brains and all of that goes along with it. We turned that report into the All In for Kansas Kids strategic plan for early childhood, and really anchored the goals of the strategic plan in the findings of the needs assessment. So access and availability of services were 2 key points. Navigating the system was a difficult lift. Families we described as being left to connect the dots themselves. So that was a major focus. The early childhood workforce had challenges. The facilities themselves were, not sufficient, not up to date, not, lots of health challenges and facility driven issues. So we've been working on the path to resolve and address the things that we saw at that time. The governance of early childhood was another key focus. How fractured we all are, and trying to improve the coordination at the state level. We can move on, because as part of this needs assessment, we did take time to focus on accomplishments over the last time period. We met the data needs by forming the Kansas Early Childhood Data Trust, which is 5 state agencies. So it is the Children's Cabinet, Kansas Department of Education, Kansas Department for Children and Families, Kansas Department for Health and Environment, and the Kansas Department of Corrections are joined together in the Data Trust. We have 4 governance meetings a year of the governing board, and we work on the deciding relevant topics for data and research and evaluation, and work to manage those things appropriately within the legal framework. And then for each project the Data Trust has adopted, we enter data sharing agreements so that the data can be merged together. So the first was our look at how our portfolio helps prevent placement in foster care. So we partner with DCF on that, and we take annual looks at it, and it's been incredibly enlightening. The data dashboard that we demonstrated for you in December is the second project, and we have had really positive feedback from folks in the field about how helpful it is for those grant applications when they're trying to assess availability of services in their community, certain demographic information. The dashboard is a good resource and tool for them. Workforce supports in the form of working to provide childcare provider bonuses. That's through DCF and the federal pandemic relief funding. The career pathway for childcare professionals and the workforce registry are both projects that have been developed as part of this package. Obviously, the Imagination Library is a big accomplishment and success story. We have been able to expand availability in the home visiting realm. The CIF line item grew so that we can contribute to that expanded availability. We continue to work on helping more and more families access services they desire and need for their children. And then obviously focus has been on expanded childcare assistance, broadening the criteria to help ensure more families can access that assistance, and expanding access to care overall. So we've got some really strong accomplishments from the PDG realm. And so our new needs assessment, I'll invite Jessica to take it from here to walk you through the core content areas so you understand how it was developed and organized, and what it is that you're looking at as you read through that document.
Thanks. Good morning. I'm Jessica Sprague-Jones. I work at the Center for Public Partnerships and Research at KU, and I am proud to be part of a very large, very hardworking team that has spent the last year working on this needs assessment. So it is a comprehensive analysis of local, state, and national reports. You'll see we include tables of all of the reports that we read and analyzed for the purpose of this needs assessment. We really tried to look at a broad swath and go kind of broad in terms of inputs and also deep. It's important to roll up those local insights, of course, and also be paying attention to what's happening at the national level, and also be pretty expansive because we understand, you all understand that there are a lot of forces intersecting to shape the early lives of children, and we wanted to be attentive to that here. We were also able to collect some new data, and so you'll find some previously unpublished data included in this report. The The needs assessment is across 3 substantive sections, a section devoted to early childhood ecosystem, a section devoted to the Kansas early childhood workforce, and then the final section is on the experiences of Kansas children and families. We do note numerous recent successes and accomplishments that have happened in the last 5 years since the 2019 Comprehensive Needs Assessment. The primary focus of this document is to articulate needs that remain and require attention. It's right there in the name. It's a needs assessment. I'm saying this to myself as well as to the rest of you because I know as I was reviewing the finding slides this morning, I'm like, I'm not used to being quite this much of a Debbie Downer, but it's really the goal of this document to identify those needs, and we aren't doing our job for Kansas children if we aren't quite clear about them. So this is very much a continuation of a lot of previous work. Our research questions were guided by previous needs assessments and the strategic plan. At the same time, there are some ways that we really took a different approach to this needs assessment that I just wanted to highlight here. One is, we're able to capture the continuation of work and system accomplishments just from the advantage of time. We also have been able in this document to focus on early childhood as an economic lever, in part because there has been so much work in Kansas focused on this area of development, and also because it has become such a focus of national research as well. And finally, it's a pretty contextual document. We really wanted to take a big picture of the driving forces that shape early childhood and the experiences of families. A couple that I would just highlight for you here are looking at how technological changes shape family experience, as well as how issues affecting rural life affect early childhood. So the first substantive section is the Kansas early childhood ecosystem. For each of these sections, we start out with key findings. They are intended to really be summary statements that roll up all of the information and data that are encompassed within a section. So for the ecosystem, it was really a set of key findings around experiences of the coordinated early childhood system. So first, fiscal and regulatory differences and a lack of clear lines of decision-making authority are barriers to delivering services to children and families. Second, the need to navigate multiple requirements and timelines inhibits local leaders and public-private partnerships from maximizing resources. And finally, multiple layers of data sharing requirements prevent a full analysis of the impact of investments in early childhood. The second substantive section is on the Kansas early childhood workforce. Two key findings here. Low wages and inadequate benefits are core challenges to recruiting and retaining early childhood professionals in the workforce, and the long-term sustainability of many programs families rely on remains uncertain without stable funding. And finally, experiences of children and families, you'll note, really echo the central messages of the 2019 needs assessment. Inadequate family access to basic needs blunts the effectiveness of early childhood services, and geographic location shapes access, affordability, and availability of early childhood services. Turn it over to you, Melissa.
Okay. So looking forward, the work is already underway to turn the findings of this needs assessment into an updated 5-year All In for Kansas Kids strategic plan. So we are restructuring and organizing the strategic plan along the same framework of those 3 core categories of the ecosystem itself. That's all of the state agencies, federal funding, and that ecosystem that exists to administer the programs, the workforce, and the children and families themselves. Our strategic plan will reflect progress made towards some of the goals in the original strategic plan, and that next layer of goal setting and visioning to carry us into the future. I will say that we are also using that as an opportunity to address the limitations of our current coordinated governance structure. So we'll talk more about that in just a little bit as well, as part of the director's update. But we are all working together as closely and as effectively as I think we know how to do as state agencies, but silos exist, and there are continued barriers to truly a well-coordinated system. That there are some big goals in place laid out by the governor in her State of the State address, and building on the recommendations of the Early Childhood Transition Task Force work of 2023. So the work is, we are mindful of those efforts as we work on our strategic plan. So stay tuned for more good things. The needs assessment itself is a grant deliverable. We are currently supporting the work of the new needs assessment and the strategic plan updates through our preschool development $4 million planning grant, which was awarded at the end of in late December 2022. We are currently in a no cost extension period on that. So this grant work will wrap up this year with the needs assessment and the strategic plan as grant deliverables, amongst other projects that the grant is supporting. So at this point, I think we're ready to entertain questions. The document itself, if we had mailed you a printed copy, it would have been hefty. It would have been probably an inch thick. It is a deep dive into the system. I think it's chock full of really helpful, useful, interesting information, and hopefully it will be a tool that can be used by organizations, communities all across the state as they work to plan and apply for things and meet the challenges. So Dawn, we'll open for questions to either Jessica or myself.
All right, thank you, Melissa and Jessica, for your presentation and your work on this project. I'll tell you what, I started to print off the document and I very rapidly hit stop when I realized how extensive it was and the strain it was going to put on my printer and my supply of ink. So thank you for your work on the document. Questions, input from the board?
I need a little Monica here. Just a little clarification. This is it's not draft format, right? But I missed where we are in the process. I know you need to submit it as a deliverable.
Yeah, so this is the designed, hopefully final version, but we have been proofreading and have found some things this week. So it has not yet gone to press. We certainly want input. If any of you saw things that you have questions about, we still do have time before we call it lockdown final. We will print a limited number of copies. I would say in this case, if you would like to receive a hard copy of this document, please email me and let me know. As board members, we're happy to send it to you, but we also are cognizant that if you're someone who would rather access it online and don't need the printed copy, it's lengthy enough that we'll be a little more judicious in terms of how much we print. So, but yeah, there's still room for your questions about things or feedback on what you're seeing in it. So that's part of the point of presenting it to you, yeah, as we work to get to final status.
Thanks for that. And thanks for all the work on this one too. This is another one that I use in the field a lot. I think I've sent the other link probably 100 times to people saying, here's the story, friends. So thanks to all of you for, again, doing the incredible detail work needed to pull this off.
Monica, if you do want to reach out, let me know, and we can, if you want to set up a call,
I'll go fine tooth comb this weekend, and I
Okay.
just haven't done it yet, but I'm sure it's perfect. But I do really appreciate the detail in it, as well as the executive summaries and the way that it's set up, that it's digestible. So thanks for everybody's work on it.
Yep. Thank you.
Yeah, this is John Wilson, and I want to echo the sentiments about the appreciation for the work that goes into this, and just want to share how I use this in the field as well. As we as KAC folks visit with lawmakers, it is nice to be able to reference a needs assessment that has been so thoroughly created and updated over the years, because there are so few other topics that have this kind of grounding needed to justify or rationalize a need for a policy decision. So when we can point to the initial work done through PDG and how many counties were engaged, how many people were engaged, how many families were engaged, it really helps, I think, again, make sure the policy decisions are rooted in data, and we aren't just making decisions based on one person's experience or some anecdote from Facebook or something like that. It really is a powerful and valuable document.
Thank you for that.
This is a very good point, John. Thank you. Further input.
I'm sorry. I just want to make clear, like, we do have some typos that we are working on revising, so we will send out a revised version of the document.
Okay, good. Melissa, since this is a not quite final document, are you okay with voice vote approval from the board at this point?
Yeah, I think it's really like, yes, work in progress, not quite final. I don't know that this is quite the decision point but please know that your final feedback is welcome, and we will be submitting this this spring to our federal project officers. So I definitely welcome input. Let's say that by the end of February, we would like to have our nailed down version, so that this is not just open-ended forever. So if you wish, as a board member, after, if you take a deep dive into it and see anything, please reach out. If you want additional conversation, let me know that, and I will get you, not as a board action, but if you have questions. I think the team at KU would echo the sentiment that we would be happy to make ourselves available to answer any specific questions. So it doesn't feel like necessarily a decision point per se, given that it's
Right.
still.
I agree.
Yeah.
But I think the impression of the board, based on the conversation, is that we approve the work that's been done so far, and look forward to the final version.
Yeah, thank you.
Okay. All right, moving on. Melissa, do you want to go to agency updates?
I think so. I don't think we have.
Okay.
I know GCF was with us. Carla had to jump off. There's legislative committees happening this morning, and I know our friends have had. It looks like corrections also had to step away for a legislative meeting. So we do have some
I'm
folks.
still here and can give a short update.
Okay. Carla, welcome.
I was just a little bit late. So the one thing that we're doing at the Board of Regents that will affect early childhood in a distant way is we are standardizing the math pathways across all of the public programs. So we will gather the early childhood programs and they will get to select which of the 3 math courses they want to include in their programs. So we have college algebra, elementary statistics, and contemporary math. The early childhood has leaned towards, the elementary ed has leaned towards statistics. And so we'll bring the elementary ed and the early childhood together at first, but if they have different directions that they want to go, we'll separate those. But that's one thing that will be coming up this semester, I will say, this spring.
That's super exciting.
Yeah, and that's all I have really.
Okay. Who wants to go next?
I can go next. This is Amy Meek with the Cabinet. And in addition to the preschool development planning grant that is supporting our work on the needs assessment and strategic plan, we also have the implementation grant for preschool development. And that started in the end of April of 2020, was a 3-year grant, but we were able to have a 1-year extension to finish up activities and spend those funds. So we're nearing the end of that, April 29th. And so wrapping up our activities. Some of our activities most recent have been around family engagement and family voice and making sure that our systems are supporting the ways that families want to engage and give their voice to our work. We're also continuing to make progress on the workforce registry, and some of the implementation grant funds have supported that. And then also the funds have supported our work to do those Kansas Early Learning Standard revisions. So we had, as Natalie said, a lot of meetings, and so we had some backbone support for those meetings. But one thing we want to make sure that we do now that the learning standards are done or approved is to print some copies. Our early childhood professionals like to have the printed version of that. It's very useful to them. So we're going to use some of our funds to make sure that we get those printed and distributed. And the version will also live online, of course, and be accessible that way. But we're going to do a Spanish version of that also. So that'll be a good way to wrap up our implementation grant and make sure that our funds are all used. Our early childhood block grant renewal application is about ready to roll out. There's going to be an informational webinar with grantees next week to go through that. But this is a renewal year, and so it's not quite as robust, but we do need them to update some of their information and make sure that we understand if they're going to propose any changes for next year and how many children they're going to serve and what programs, and also a new budget, of course. So that will be happening and opening up in the next week or so, and then giving them just a little bit over a month to get that turned in. So we can bring you some information at the April meeting about that and those grants that will begin on July 1. Lastly, the recommendations panel, the early childhood recommendations panel, which serves as an advisory to the cabinet in their role as the Early Childhood Advisory Council. The membership applications will open on April 1 for that, for the next membership term, which will be July 1 of 2024 through June 30 of 2025. So April 1, we'll have an application on our website for anyone that's interested in becoming a member and serving on that panel. The panel meets once a month, and then occasionally we'll have some other work groups meeting outside of that time. But just wanted to let people know so they can start thinking about that if they're interested. There's some information on our website now if you want to read more and learn more about the panel. And we'll also do a reminder at our April meeting. That'll be open until May 3rd, that application round. So that is all I have.
All right, thank you, Amy. Amanda? Are you with us?
I am. Good morning, everybody. I hope that you all are doing well. We've got a couple of pieces going on at the Kansas State Department of Education. One, we are very excited that the Children's Cabinet today voted to approve the updates to the Kansas Early Learning Standards. The State Board of Education also voted to approve those standards when they met in January. So that is very exciting to see that work moving forward, and we appreciate all of you and your partnership on that. In terms of other updates happening, some of you may be familiar with the Registered Teacher Apprenticeship Program. That's been a partnership as a pilot this year between the Kansas State Department of Education and the Department of Commerce and local school districts. It's involved a small number of school districts as we get that program off the ground. And for the starting year, it was limited to teachers seeking a degree in elementary education. I'm very excited that next year it's expanding to include more higher education partners and be open to more school districts. And it is also the piece that I am most excited about. It's also going to include Early Childhood Unified as one of the licenses that an apprentice could gain after participating in the program. So that's a big deal. That's the license type that allows a preschool teacher to teach in both a general education and a special education setting. And we are very excited that that's going to be included. So that application is now live. There's going to be information, or there was information about it in KSDE Weekly last week. And we've shared information for the All In for Kansas Kids newsletter in a future week. And those applications are due on June 1st. Looking ahead, the State Board of Education is going to be considering Kansas preschool pilot grants when they meet on February 14th. I shared that with you all because about half of that program's funding currently comes from the Children's Initiatives Fund, and the remainder comes from Temporary Assistance for Needy Families, or TANF. That program has grown significantly since it was first established as a pilot in 2006 to identify whether or not we think that preschool is a worthwhile endeavor. And now it funds about 60 grantees to support their operating expenses for preschool. It is at $8.3 million. It is certainly larger than the amount of funding that was available in 2006. But it is also not nearly enough to be able to fund operating expenses for preschool in districts across the state. And so this year, to try to balance the administrative time of writing grants, our team chose to largely operate that grant application process as a renewal, where existing grantees were invited to renew their grant. And so long as their budget demonstrated that they still had a need for the funding, they'll be receiving that same amount of funding for next year. After we had been through that process, there was about $250,000 for us to award out on a competitive basis for a couple of programs. So the state board will be considering that in February. Other pieces that are going on, we have finished pulling the 2023 calendar year ASQ screening data. We were so close to breaking 100,000 screenings statewide this year. We ended up at about 95,000. So I'll be very excited for us hitting that milestone next year. I think that I jinxed it as we were going through the needs assessment updates. I had put in a note for Sarah Gardner that I would follow up with her after January 1st to say, I think we're going to be over 100,000, and we were just short. But either way, it's still, we continue to see the use of that system increase as more partners work to make sure that young children are receiving developmental and social emotional screenings. And if anybody is interested in a deeper dive in that data, the State Interagency Coordinating Council will be having a more in-depth discussion when they meet on February 16th. So those meetings are open. If anybody is free that Friday afternoon, they're welcome to reach out to Stacy Clark to join that conversation. It's a virtual meeting. And then finally, our bigger picture, our agency does continue to work on an updated and approved system of accrediting both our public and private school systems in Kansas. We're looking forward to something that's going to be more streamlined and more meaningful and have a stronger focus on quality classroom instruction. So we are hard at work to make sure that we continue to help systems improve their efforts to strengthen early childhood and kindergarten readiness as a part of all of that. And we are looking forward to next school year when we'll be rolling that out. So I'm glad to answer any questions or turn it over to whoever is next.
All right, thank you, Amanda. Any input for Amanda? All right, seeing none. Thanks, Amanda. We'll move on to Dr. Jesse Piper from KDHE.
She maybe had to jump off as well, Dawn, we could move on to Amy Raymond from the courts.
Okay, fine. Amy?
Good morning, everyone. It's nice to see you and hear about all the wonderful work that Kevin's doing. I'm Amy Raymond. I'm the Chief of the Trial Court Services for the Office of Judicial Administration, sitting in for Justice Wall today. I just have two updates for you. We are deep in planning for the inaugural Child Welfare Summit that will happen April 15th and 16th here in Topeka. And it's a 3-branch initiative to bring together all of our child welfare partners to collaborate on ways to improve permanency for children in the child welfare system. We're structuring it so we've asked each of the 31 judicial districts to bring a team of people, judges, attorneys, child welfare grantees, DCF staff. We have an incredible lineup of presentations. Each team will have some questions for them to reflect on and consider prior to coming to the summit, and then also a document to create an action plan for going forward. So we're really, really excited about that initiative. As we reported at prior cabinet meetings, we publish, the Supreme Court on Task Force on Permanency Planning publishes a child need of care code book and a juvenile justice code book every year. And those code books are updated with any changes from the 2023 legislative session, and they're posted on our website. So those are just the two brief updates that I have.
All right, thank you, Amy. Feedback for Amy?
I'm signed up, Amy. Looking forward to the summit.
Excellent. We're very excited.
Also, welcome back. Nice to see you. I know Justice Wall was in court this morning, so appreciate you stepping in.
No problem. Nice to be here.
Moving on to Matthew Billinger from Department of Corrections and Juvenile Justice Authority. Welcome, Matthew.
Thank you. I'm Matt Billinger with the Department of Corrections, a coordinator for the Juvenile Justice Oversight Committee, which Amy is one of our members, so glad to see you again. A few things that we have going on right now. The Stepping Up is a program that is getting going. This was an established program more on the adult corrections side, with the goal of providing more community services around behavioral health and deter additional incarceration. The community pushed and is executing a juvenile version of that same program. And Kansas is the first to do so, to be putting Stepping Up on the juvenile side. So we are the pilot state for that and really excited. All the contracts are signed and executed, and a planning team is in place, starting to implement a lot of those ideas. So one thing I'm really excited about this is it's really truly a multi-agency approach. The planning committee includes DOC, DCF, KDHE, I think Amy with the OJA again, legislators, governor's office, and many other stakeholders are part of a team that's building that up. So it is definitely a kind of holistic approach to addressing those needs in the juvenile justice system. We're also getting ready to launch our family engagement initiative. This is a new offering in Kansas where we coach supervision officers, court personnel to be more engaging with the families, while also helping to educate families about the court process and what's going on and what they can expect, as well as like what resources are available to them to help them walk through that process. And also with a goal to empower them to really be a part of the team to help that youth, so that they become more involved in the process and not just kind of an outsider, to really get those families involved and hopefully get them more support in changing the life of that youth. So we're working directly with families on this a lot. They're part of the input in the planning process and getting input on the materials that we're putting together. So I'm very encouraged to see this really kind of start to happen. I think the first training is in March or April. Haven't announced those dates or sent out materials yet, but that should be coming pretty quickly. Lastly, the Department of Corrections is working with the Juvenile Justice Oversight Committee to help implement some of the legislation that went into effect last year. A lot of this, in summary, is to kind of help ensure that when youth are placed in detention, there's more wraparound services in place, and they aren't just sitting in detention waiting for the next court date. So we're working with a lot of those county juvenile detention centers to help get those services in place and get a lot of those requirements from that House Bill 2021 into effect. There's a few other pieces of legislation that we're watching that include things like how courts can extend probation, the use of juvenile restraints in the court setting, and there is a couple pieces of legislation about eliminating fines and fees for youth that are adjudicated on criminal charges. This is kind of a national movement we've seen, but we also know that Kansas established a lot of those processes already. There's in place for waiving fees and stuff. And as we kind of talk more about this legislation in our groups, we're finding that a lot of those fines and fees were already waived more often than not. So we're just kind of providing some input to our legislators on that, but also kind of looking to see how that moves along. So that kind of wraps up any updates I have for you all. Of course, there's a number of programs going, but those are kind of the highlights of some new things coming. I'll be happy to take any questions or provide any more information if anybody needs any.
All right, thank you, Matt. Questions or input for Matt?
Dawn, I can, if no one has questions for Matt or any of the previous agencies, I have written updates from DCF. There's just 3 quick points that they wanted to make. Number one, very exciting for families in Kansas, that the initial income limit for childcare subsidy is being increased effective April 1st, 2024. They'll move the scale to 85% of state median income. This is the highest allowable limit allowable under the federal program. So it's the culmination of a lot of effort over the last several years. I know the agency has really worked on improving the amount of funding we are eligible to draw down, and the state has provided additional resources to make that drawdown possible. There is additional funding we can draw. Another feature in the governor's budget, I think, is continued effort to maximize the drawdown. But that is huge for Kansas families. So we shift from it will increase the amount of the monthly subsidy that families can access to help offset the cost of childcare in Kansas. The agency is drafting their new 3-year state plan for childcare development block grant funding. The draft is due to the Office of Child Care by March 26, 24, and they are this month going to be engaged in community outreach and work with us as their state agency partners. They will be reaching out for input on their draft plan, and then they are preparing for their annual the upcoming triennial federal monitoring visit for the child care development program from the federal partners. And I know Amy has been engaged in the planning team on the cabinet's behalf. And so that will be this springtime as well. So those are the big things they're working on. And KDHE has been really focused on the revisions to the state child care licensing rules and regulations. That is where our friends are this morning. Both DCF and KDHE had to appear in front of the Legislative Oversight Committee for Rules and Regs. So we are really hopeful that we will very soon receive approval out of the Attorney General's office. That is where the regulation changes are currently. Once the Attorney General has reviewed and stamped them as approved, the next phase will be a 60-day public comment period. And then once public comment is wrapped up, there will be a final committee process. The Joint Committee on Administrative Rules and Regs will receive the approved changes, and the secretary will sign them into law, or not law, but into practice. So we are close, but right now the step we're on is Attorney General approval. So just wanted to share that. John, I see your hand raised.
Yes, I just had a clarifying question on the DCF piece. So did I hear you correctly that as of April 1st, they are increasing the income eligibility for the child care assistance program to 85% of the state median income?
Yes.
Okay, great.
So we're really excited about that step. That is the extent of my knowledge on the details of that. So if you have further questions, I would direct you to Dr. Carla Whiteside Hicks at DCF.
I'll just say I think that's a fantastic idea, and you'll occasionally see two numbers thrown around: 85% of state median income or 250% of the federal poverty level, which I think is where we have had eligibility. And 85% of state median income is slightly higher than that. And so that's great news because more families can qualify for the child care assistance program.
Yep. So we're excited that they were able to work the budget to make that happen. Okay, that's the summary of the work going on across other agencies.
All right, thank you, Melissa. So we are ready for your director's update. And as always, there are other things going on that we have not yet covered. So
there are, believe it or not. So with as much as you just digested, there's still more. I had touched on governance work happening, the idea of realigning where early childhood programs and services are housed within state government. Last year in 2023, the governor issued her executive order creating the Early Childhood Transition Task Force. The task force spent the year studying the Kansas system, learning from other states that have done this type of work, traveling the state to take input from Kansans, and then spent the fall working on draft language for a report that was adopted and delivered to the governor in December. So that report from the task force recommended realignment of core identified programs and services that really reflects movement from across the four entities that at the heart of this work. So it is us as a cabinet. Our whole Children's Initiative Fund is kind of at the heart of early childhood work. The Kansas Department of Education houses parents as teachers. That is on the list of programs in the report that would move. Our friends at the Kansas Department for Health and Environment actually have the child care licensing program in-house, and a variety of home visiting programs and services. So I won't go into the details, but home visiting and licensing would move from KDHE to this and the central entity. Department for Children and Families has the Child Care Development Block Grant funding, which supports the child care subsidy program, child care provider, child care quality improvement work. That's the professional development with our child care providers, and their funding supports the licensing arm. So those are those core functions. DCF is also the location currently of the Office of Head Start. That would be on the recommended list. There's a lot I don't know, but what I do know is that there is a bill being drafted currently that is set to hopefully within the next, we're on Friday, so I'm fingers crossed, maybe we'll see something next week, a publicly available bill that gets introduced that is set to be responsive to the recommendations of the task force. I know our recommendations from the December meeting that the cabinet governance structure, our role and responsibilities would be integrated into this new entity. We delivered those recommendations to the governor, and I have been assured that they will be taken to heart. So I know the cabinet will be part of this realignment. Where our recommendation was that we retain our grant making abilities and responsibilities and oversight for the Children's Initiative Fund. And I have not received any indication that anyone thinks that needs to change. So we will be integrated into an office that will administer a number of other programs as well. So we are looking forward to having a bill that we can discuss, and I will make a note that when that bill gets introduced, I will share a link so that you all have access to it and not make you wait and dig for yourselves. So we'll make that easy for you to access. I had mentioned one really exciting recommendation in the governor's budget report regarding the $30 million that is being recommended that the cabinet receive to expand the Child Care Capacity Accelerator grant making. That's not all. And we have another proposal that would provide $5 million in SGF funding one time to address the proposal that Betsy Waring from the Dane G. Hansen Foundation presented to the Children's Cabinet at our August meeting. That vision is to create a public-private partnership. So the $5 million would represent the public dollars, and then the private sector would put another 20 million total is their goal. But the Dane Hansen Foundation is planting $5 million in seed money of their own from their foundation. They are engaged actively in I don't want to call them negotiations, but they have another foundation that operates in the early childhood space as their core focus area that is very generously coming to the table. And the expectation is there will be an additional $5 million coming from that foundation that we will be very excited to name later. So already that would be a 2-to-1 match for the public dollars. And the goal would be to continue private sector fundraising, could be additional philanthropic dollars, but also the business sector to meet the goal of creating an endowment worth $25 million to serve the Northwest region of Kansas, the catchment area for Dane Hansen. We would be watching this as a pilot, to be honest, of how that kind of effort makes a difference. Their goal is to support childcare providers in their catchment area and provide anything from emergency funds. Betsy likes to use the example that if you have roof damage from a storm that comes through, you may be well covered by insurance, but not have your $5,000 deductible in the bank to be able to do those roof repairs. And it could mean the difference between continuing a childcare program or having to shut down. So from that kind of emergency situation to sustainability grant funding along the lines of some of the models that we've seen working around the state, like baby steps for one example. So very excited to see that funding has been proposed to allow us to offer that $5 million match, and then work with the Hansen Foundation on all of the reporting that can show the impact of such an investment. The governor also rearranged our Children's Initiative Fund just a bit. So the line item transfer to support family preservation services that take place at DCF, that CIF transfer would be stopped, and state general funds are proposed to be used to provide that match for it's basically the match for Family First Preservation Program funding. We would gain a little bit of budget capacity in the CIF, and the governor is directing that $815,000 of that capacity be used by the cabinet for financial incentives for specialty childcare, which is a fancy way of saying we really like the baby steps model that Child Care Aware has had in the field for the last year with grant funding courtesy of the Patterson Family Foundation. This would be $815,000 to keep those types of incentives going for another year. And then 1.3 million would transfer from the CIF to KDHE to continue the child care health and safety grants that have been in place using sources from pandemic relief funding. We'd like to continue. As a reminder, these are not large grants. I think the cap is around $5,000, but these are grants that help providers address health and safety issues so that they can get licensed and stay licensed successfully. So we want to see that grant making capacity continue. So that would be a CIF line item transfer. There are other proposals in the governor's budget report that would benefit early childhood in other ways. There's a proposal to transfer $15 million to DCF from State General Fund, again, as a one-time boost to the child care providers sustainability grants. Those closed because of the completion of the federal pandemic relief funding cycle, but this would give another round. DCF could open one more round for child care providers in the coming fiscal year, which would be important resources for them. And then there's 1.1 million of that extra capacity in the CIF that would be dedicated to supporting the workforce registry to sustain that project moving forward. At the moment, that is in the budget as a transfer to DCF. So stay tuned. There's a wealth of really good things proposed, and hopefully we'll see support for those items through the budget process. And then I did want to update, there was a House bill introduced on January 29th, House Bill 2613, that is on my radar. I don't know of a hearing on it yet. I'm just watching it. It proposes a direct transfer from the key fund to the Attorney General's office of $300,000 to support the DARE program in schools and support, I think they want to hire a position to coordinate the DARE program statewide. What I will note is that is a highly irregular way of doing business. Those direct transfers should not happen from the key fund to anywhere other than the Children's Initiative Fund. And if we are looking at the DARE program through our CIF lens, I asked the research team at WSU to take a look at the research about the efficacy of DARE, and just say the reviews are not great. The reporting, it's hard to make the case that this is an evidence-based model that would fit the normal profile of a CIF funded program. So that is all I'm going to say on that. I would be happy to entertain any questions about budget or anything else at this time. Don, that's everything else we've covered in terms of cabinet.
Okay,
updates.
thank you, Melissa. I'll go first. The reconfiguration of early childhood governance is a big deal, and you say that there's a bill being drafted. Two thoughts. Those of us that have played in that legislative arena know that the legislative session can get away from you very quickly.
Yeah.
So there's a timeline that is somewhat of a constraint. It also occurs to me that this is happening parallel to the appropriations process, and some components of the appropriations may need to be reconfigured if and when the early childhood proposal actually becomes a reality.
That's a great point, and I would say that's factored into the task force report and will be a function of the bill. The goal, the governor's budget includes a small amount of funding to fund the position of an early childhood transition director. So that would be a position, somebody hired with expertise in the kind of reorganization that this represents. So the logistics and planning capacity and experience to make sure we spend the next year planning for an effective transition. So the movement of the programs would not take place in the context of FY25. So starting July 1, 24, we enter state fiscal year 2025. The transition director would be engaged. I'm getting a note, the budget does not have that line item, but we would actually entertain a transition period of a year that would allow us to carefully plan, and then the goal would be to get that operational by July 1, 2026, 2025. Sorry, fiscal years, calendar years, federal fiscal years. July 1, 2025 would be when we would, the goal to make transfers go live would be the point of this. There are deadlines for introducing bills. You're right. The legislative session begins to take on a life of its own. I think I am not on the team that's working on the bill draft. I know the folks who are cognizant of all of those deadlines and are working to release the bill in the very near future. But work has been happening to visit with lawmakers about their thoughts. So I think you know, I think there's a curiosity about what this will look like, and an open attitude that, you know, with certain constraints and parameters, there's interest in what this will look like, would be the way I would characterize it at this point. So it's always the details of the language of the bill that will matter.
Okay, thank you. Further questions or input for Melissa?
This is Monica. Sorry, John, was that you?
It was me, but please go ahead.
Well, thanks, John. I just want to say that I'm excited about this. I feel like, you know, there's a lot of details hanging out there, but I really feel like this is the direction that we should be exploring, and glad it's happening. And I think it really fits in with what we talked about at our get together that we had in the fall. So looking forward to how this all hashes out, and happy to help in any way.
Thank you.
And what I was going to, this is John Wilson. What I was going to say is this is a shameless plug, and I don't feel bad about it, but KAC has a weekly newsletter that we send out that provides a summary of what's happened in the legislature as it relates to bills impacting kids and families. And so a number of the things that Melissa talked about will likely see some action in the coming weeks. And so if you want to know about those and know how to use your voice to weigh in on those things, you can go to our website, kaac.org, and sign up for our newsletter.
Very good. Thank you, John.
Further remarks from the board? Well, seeing and hearing none, Melissa, I believe that wraps up the meeting pretty well.
So heavy on the background material, but we kept the meeting moving. I appreciate the time and attention from all of you very much.
Right. So you saw the timeline for future board member meetings. It's the regular schedule, the first Friday of each alternating month. So our next meeting will be April 5th.
Which is not Easter weekend.
That's handy. Good.
Yep. So, all right. Well, it's nice to see everybody. Again, get your feedback on the needs assessment to me sooner rather than later, because we are trying to lock it down and be able to turn it in. So we're looking forward to hearing from you.
All right. Seeing no further business to come before the cabinet, I declare the meeting adjourned and look forward to seeing you in April. Thanks, everyone.
Hi, everyone.
Bye.